Olympus has received complaints from users reporting that mucosal tissue was found within the single-use distal cover after withdrawing the TJF-Q190V, Q290V, and Q170V duodenoscope. Olympus conducted its root cause analysis, and the most likely contributing factors are the distal cover with or without a crack on the tear-off line, and use of suction during withdrawal. For example, mucosa may be sucked in the single-use distal cover by performing suction with the distal end opening close to the mucosal surface. When the duodenoscope is withdrawn while mucosa is sucked, mucosa can be cut with the distal cover. If the distal cover has a crack on the tear-off line, the mucosa could be further caught in the crack. In this case, even without suction, mucosal injury could happen when the duodenoscope is withdrawn while the distal end of the duodenoscope is pressed on the mucosal surface. Olympus is asking all TJF-Q190V, Q290V, and Q170V duodenoscope users to carefully consider and follow these recommendations. Do not use a single-use distal cover with a crack. Follow the directions in the instructions for use when attaching a single-use distal cover to the duodenoscope, attaching it gently and without excessive force. For example, a distal cover attached by inappropriately placing the fingers around the cover or pushing from an angled direction may cause a crack or deformation in the distal cover. After attaching the distal cover, confirm that the tear-off line and other parts of the distal cover are free of cracks or deformation. If irregularities or incorrect attachments are found, detach and replace it with a new one. Do not use suction during withdrawal in motion. When using the suction function, confirm the duodenoscope is stationary. Stop the suction function before moving the duodenoscope. Confirm the endoscopic image is clear, the elevator is lowered, and the angulation locks are released. Then withdraw the duodenoscope. If mucosa is sucked in the single-use distal cover, the endoscopic image is not clear. In this case, do not withdraw the duodenoscope. Even if the suction valve is released, the sucked mucosa will not be released for a few seconds. Again, confirm the endoscopic image is clear, the elevator is lowered, and the angulation locks are released. Then withdraw the duodenoscope. Inspect the distal cover post-procedure. If mucosal tissue is found within the distal cover or trapped in the forceps elevator after withdrawal of the duodenoscope, please consider endoscopic visualization of the upper GI tract to assess for potential injury requiring medical intervention. We believe at this time that the subject duodenoscopes can be safely and effectively used according to the device's instructions for use and the additional guidance provided in the customer letter. However, if any irregularity with the endoscope is observed, please refrain from using the endoscope on patients and contact Olympus.